Hi, I'm Dr. Emma Craythorne, a consultant dermatologist, and you're listening to the After Hours Skin Clinic, the laid-back podcast where we dive into all things skin. In these bite-sized mini episodes, I'm going to share everything you need to know about a question I've been asked outside my clinic. In this episode, we're talking about puffy eyes. Now, it really is the time of year where many people are coming in with puffy eyes, wondering what to do about them. And most of my friends are also asking about what to do with their puffy eyes. It's very easy, all my friends. Go to sleep earlier. But it is actually more than that. Puffy eyes are as a consequence of many different things. And actually, lack of sleep is really one of them for those people who get this temporary puffiness of the eyes. So some people have a temporary tendency to puffy eyes. So your eyes might not be puffy one day, but the next day they are. And then there are some people who have chronic puffiness of the eyes. And it's the chronic puffiness of the eyes that's often a little bit more difficult to deal with. And if you're somebody who does have chronic puffiness of the eyes, you probably want to look through your parentage and see, does this run in one of the sides of the families? Because often this is a genetically inherited trait. But let's think about, first of all, those temporary puffiness of the eyes. So lack of sleep is certainly one of them because it leads to fluid retention. And one of the areas that we will often see fluid retention is in the face and is around the eyes. Often people with allergies, they can get some inflammation and swelling around the eyes. And particularly if you're rubbing your eyes, the rubbing action can cause swelling, which causes you to rub and then you swell. And this gets into a vicious cycle. Another thing that happens is over time and how we age, the area of the muscles and the tissues and the fat pads around our eyes, well, they also age. Our anatomy around our eye consists of these concentric muscles. It also sits of different levels of fat pads and quite important ligaments. And aging causes regression of our bone structure. It makes our orbital ridge in which our globes sit become much wider, so our eyes appear more sunken back. And those fat pads start to drop. And as a consequence, this means that fluid is more likely to gather in these areas. And that's another reason why people get this puffiness. Sometimes it can be related to our diet, and certainly high sodium intake diets can cause fluid retention with puffiness around the eyes. And something that I'm probably seeing more and more of in this last decade is puffy eyes as a consequence of dermal filler injections. So hyaluronic acid filler injections have been used for, 20, 30 years on the face. Often high volumes of these or repeated treatments of these over a long period of time means that the hyaluronic acid builds up. It doesn't just disappear. It stays in the skin for many years and can often block lymphatics. So something I'm really starting to see now is this tendency where we get puffiness as a consequence of these lymphatics being blocked up. And then for some people, there's also things like rosacea that can cause this puffiness of the eyes. So what can we actually do about them? Well, first and foremost is to understand, have you this genetic tendency to have this? Is this to do with aging? Because quite often, a lot of the things that we might suggest that you would do might only have a very small temporary effect. Whereas for those people who this puffiness of the eyes comes and goes, well, then this will actually typically be more useful. But what to do at home? Cold compresses, are they helpful? So this idea where you would sit with a nice ice cold cucumber on your eyes to reduce the puffiness of it. The cucumber, of course, has been left in the freezer and then you bring it out and set it onto the eyes. Will that actually help? Well, in truth, actually, yes, it does. It constricts the blood vessels and it starts to reduce some of the swelling. So this can be helpful in the same way that using chilled spoons and massaging those over the eyes can also be helpful as well. Sometimes people use their old tea bags. So these are tea bags. It could either be green tea bags or black tea bags. And you keep those in the fridge once you've finished with them. So have your nice cup of tea first. Don't waste the tea bag. And then you can place these on top of the eyes in the same way that you might have done a cucumber. They're thought to have a little bit more antioxidant in them, and even more of a bonus is that they'll have caffeine in them. And these are also said to reduce puffiness and inflammation. And in fact, some of the eye creams that you might pick up to reduce puffiness on the counter has caffeine in it as well. So your tea bags are a really inexpensive way of getting a lovely mask for those puffy eyes, but you do need to keep it in the fridge or freezer beforehand. If you are somebody with a tendency to allergies, particularly at night time, you might want to adjust your sleeping position. So don't sleep face down. Try and alternate sleeping from side to side. Ideally, sleeping on your back on an extra pillow would be even better. And then my favourite thing of all, really, other than the tea bags, is the gentle massage. And gentle massage, you can find really good videos on YouTube, and you're able to then move out the fluid that's built up under the eye area with key massage techniques. I think this is really helpful for people who have inflammatory skin conditions like rosacea, where they end up getting fluid. And it's also very helpful for those patients who have had dermal fillers, hyaluronic acid fillers, and it can help to clear the fluid away that way. There are some skincare products that are specifically designed for puffy eyes, and they typically will have caffeine in them, a bit like the tea bags we talked about. And then there's also some tools that can be used, like gua sha tools, ice globes, jade rollers. And these are all working in a kind of similar way that a chilled spoon might work. So both can be just as helpful as the other. You'll often see eye patches that will sit under the eyes claiming to reduce puffiness of the eyes. And these can actually be really helpful. Most of them have caffeine within them, which acts as a bit of a constrictor of the blood vessels. And that in itself helps to reduce the puffiness of the skin. So they can be very helpful. They're an in-the-moment treatment, so they're helpful for that moment in time. They're not something that's going to have an impact on you having puffy eyes the next day or the day after, but certainly before an important event or a makeup session, then these under-the-eye patches can be helpful. What can you do in your lifestyle to help prevent the puffy eyes or improve them? Well, right at the very beginning, I said getting enough sleep, which is really difficult sometimes for many people. But in truth, getting enough sleep really does help if you're somebody who gets prone to puffy eyes from time to time. Managing any allergies that you might have and managing any inflammatory skin condition, such as rosacea, that might also be contributing to the puffy eyes. Staying really well hydrated, so drinking a lot of water, avoiding things like a lot of sodium in your diet, and really reducing the amount of alcohol that you'll be drinking. All of these things are something that you can actively do to reduce the puffiness of the eyes. But if you're somebody who really is continuing to suffer from this persistent or very severe puffiness despite trying all of these things, then that really is the time to see a dermatologist or see an ophthalmologist to try and understand why this is happening to you. There are lots of different things that we can do in clinic to try and reduce the puffiness of the eyes. And it really is worth having that conversation, because often puffiness of the eyes can really have an impact on someone's quality of life, especially if this is happening every single day and consistently. So do come and see one of us, because we can go through the options that are available in clinic. Some of those options are things like laser treatments, sometimes are injectable treatments, and sometimes it's actually surgery is required to treat some forms of puffy eyes. For those with very severe puffiness of the eyes, and that's typically due to changes within the fat pads or aging related changes, then blepharoplasty is a very good option. You would need to speak to an oculoplastic surgeon, and they will go through all the risks and benefits of that. So if you're somebody who has very severe puffiness of the eyes, then it is worth getting that opinion to see if that can be beneficial to you. So to recap on this, puffy eyes are a really common issue, and they can be caused by a huge number of reasons, and sometimes it's just down to our genetics, and other times it's down to our particular lifestyle at that time, and sometimes it's due to some medical conditions. So there are interventions that we can make in any of these steps if your puffy eyes are becoming a real problem for you. Okay, that's it from me this time, and I hope that helps. Don't forget to click on the subscribe button so you don't miss out on our twice weekly episodes when they drop. And see you next time on the After Hours Skin Clinic.